Hi guys, we're back for another Schein Chats. My name's James Salter from Henry Schein, and today we are joined by Dr. Douglas Watt, Principal Dentist at Euston Place Dental Practice. So today we're going to talk about digital dentistry. Doug is a KL within that space in the UK and internationally, and we're going to explore the digital workflow with him. So to begin with, Doug, how do you get started in digital dentistry? What was that point where you went, I've got to be part of the digital workflow?
So when I moved to the practice I'm at currently about 6 years ago, they were using CEREC machines already within the practice. So, so we had a couple of blue cams and mills.
In-house milling.
In-house milling, scanning, and very soon after I got there we invested in a CBCT scanner as well. And I tried the CEREC machines, used that, enjoyed it and thought I'd get involved in this. Then I was speaking to my lab technicians and they recommended I'd look at a Trios scanner.
Yep.
So I got in touch with a chap called Dale from Dale Flanagan from 3Shape, and he came over with a scanner and I actually prepped my dad's teeth for £2 crowns.
Yeah.
Scanned them, tested it out. I'm sorry, Dad. And then, fitted the crowns a couple of weeks later and, everything fitted. Then got Dale back a few months later and we did another case, 3 to 3 crowns. And I prepped those, scanned them, fitted them, everything fitted fine. It was, a bit of a revelation because I wasn't all going through a lab, but I wasn't actually that certain about the workflow that it was all going to fit and there was going to be no adjustment or anything, but actually everything fitted so seamlessly, and I thought, if I go down this route, then hopefully it just gives that degree of predictability, that is a confidence in the fit and the lower number of remakes and adjustments and all the things that worried me more with conventional dentistry, and I found it actually to be very predictable. So then I invested in the Trios. Following on from that, we then invested in a 3D printer and then got so we got the Rapid Shape D20, started using that.
So what type of work are you doing with that 3D printer? What sort of
so we started off just with surgical guides for implant work. So we got the implant studio planning software, designed the guides, started 3D printing them in-house. And then further on I started getting into digital 3D mock-ups, 3D printing those, using those for diagnostics, for doing direct and indirect composite work on the teeth, so doing palatal stents off pre-designed digital mock-ups. And then we've not got into digital dentures 3D printing that yet, but something certainly we'll look at. And we've also done 3D printed temporaries, so implant work. So printing the temporaries before the implants have been exposed to offer surgical scan with the Trios and all that kind of workflow. Which is
so in terms of that, obviously you've made some significant investments. What has been sort of the core benefits, to the practice, to the team, of making those, creating that digital workflow throughout?
I think there's been a massive degree of excitement within the practice because it changes things and everyone gets involved. And with a lot of the digital stuff, the nursing staff can get involved in it. They can see the patient's reactions to how the digital workflow has changed dentistry and improved things. And so my nurse has learned to scan now. She's done some scanning for whitening trays. She does a lot of the printing side of things, so I design as she does the printing. So it just gives extra interest in how things, extra sort of things for the staff to do that they enjoy, rather than just the same mundane.
So actually, it's like staff morale and just the whole.
Everything just feels better, and we feel as well we're at the cutting edge. Everyone's at the forefront of what we're doing with digital dentistry. So actually, the staff really feel we're doing the best for our patients, we're doing the best in the practice, because everything we do is nice and predictable. We can show people things from a patient's perspective, being able to just take a scan and show them exactly what's going on in their mouth. It's brilliant for uptake of treatment because people know why you're suggesting what you're doing. If before you just, you need a crown on this tooth.
That patient communication has just gone to another level.
And with the digital mock-ups, with the excitement apps and Trios, that massively helps. So you do your Smile Designer mock-up.
So you're using those apps, the Smile Design.
So
which is fantastic.
I don't do ortho, but other people in the practice who have Trios do ortho, do all these different things like the Smile Designer, like the treatment simulation that shows them potentially the position the teeth can move to with orthodontics. And Yeah, we use all those apps, and also the wear management. People can see what the changes in their teeth over time, so you can compare the scans. So all that kind of stuff really involves the patient in the treatment, involves them in their problems and why you're suggesting the outcomes.
So it's benefiting obviously the team.
Yeah.
Obviously the patients coming in experiencing this new technology from a cost efficiency standpoint, is it?
So with the in-house milling, I mean, obviously you invest in that on that one side, but on the flip side you save quite a lot of money on the lab fees and things like that. So especially when I'm doing posterior mill restorations, if I'm just paying for a block, it's a milling it myself. I have control. I know the buck stops with me, which in some ways is a good thing. In some ways, I've got no lab technicians phone up and shout at if it goes wrong or blame. But also the staff can get involved in that. So it's not just my time. If I say, you know, need to design a crown, I can get it all set up and ready to go by my nursing staff, and then if they can do a lot of the work and just get it signed off by me. So it's so easy in the Trios design studio to just design a crown, and it does most of the work for you. So you just click on a margin, the margin comes up, you design the crown, it's ready to go to mill, I sign it off, and then it can just be clicked off to mill, and then it's really good sort of work.
I know obviously you're working closely with 3Shape as one of their KOLs. Are you working on any studies at the moment in terms of?
So at the moment we're doing the direct integration with the roll and mill, so we're looking at that, and the also screw retain crown design going into the roll and mill. So tie bases directly off dental design studio, off Trios scan. So and that's really nice workflows, and again, that design studio predictability of and same day crown design, all that kind of stuff is great. And for implant work, it's nice being able to scan the implants at the time of surgery and then have all that design and ready to go. So that's what we're working towards at the moment, seeing if we can put the implant in, do a digital scan of it. Then once we've got that scan, we can just make a temporary or permanent crown or whatever to go in at the same time as exposing the implant, or take a healing cap out and put, it decreases the appointments, decreases the surgical stage for the patient. So that's what I'm moving towards.
Again, creating those efficiencies across the board.
Exactly.
Fantastic. I suppose final question. I know you've always got your finger on the pulse in terms of technologies coming through. What are you seeing as maybe the next thing that?
I think a couple of things to keep an eye on. One is going to be the facial scanning and direct integration of smile design, transferring 2D smile design into 3D smile design, so using things like Smile Frame, Smile Designer, to then, say for example in the dental system software, you can do your Smile Frame, then get a digital mock-up, drag that all out into the Smile Frame and get a 2D to 3D transfer that then can be put on a picture of the patient to show what the digital mock-up may look like intraorally, and that's improving and getting some more photorealistic and better as the software develops. And I think the 3D facial scans are going to be good. They're a bit scary at the moment, but I think that's,
they'll get
that's
there.
going to improve. You know, with the new CT scanners that are having facial scans, it's improving from the mobile phone scanning apps and things like that. The other thing is digital implant workflows, I think, are improving. So the system I'm using at the moment, you can get scan bodies not just for the fixture head of the implant, but scan bodies that go onto abutments and multi-unit abutments. So the scan bodies go direct onto those. So then you're working at abutment level with a scan without having to scan the abutment, rather than scanning just the fixture head of the implant, which was how you traditionally would have done it. So it's sort of the digital equivalent of impression coping is going directly onto an abutment, which I think is going to be brilliant, working at fixture level and doing a really nice sort of workflow there that's less invasive for the patient, predictable.
Again, about patient experience.
And it's all patient experience and dentist experience. It's all very predictable, that you know that is going to fit perfectly, because the STL file you get from the software is going to be the exact shape of the abutment that's in the mouth, without any soft tissue worries or anything like that. That scan body then transfers all that information to you. That predictability of fit, occlusion, lateral excursion, looking at the new motion, patient-specific motion in 3Shape. I think all that, you're not using a digital articulator that's generic values, you're using the patient's actual movements. All that just massively increases predictability. So you've got this really predictable workflow, fewer remakes, perfect fits, issues with excursive contacts. It just makes everything so smooth and easy, and I think all those things coming together and all into one package just makes that workflow sort of really,
absolutely
really
fantastic.
good. And it's fun, it's gamifying dentistry. And
I know you enjoy it, I know you enjoy it. Lots to look out for then,
yes,
is the
plenty
answer.
going forward, I think.
Brilliant. Doug, thank you so much for your time today. It's been a pleasure.
Cheers.
Thank you.
You're welcome.